Hi everyone, welcome back to my channel. Let's see about inguinal hernia. Inguinal hernia. Inguinal hernia laterally inferior epigastric artery. Laterally inferior epigastric artery. Medially lateral border of rectus muscle. Lateral border of rectus muscle. Inferiorly inguinal ligament. Direct inguinal ligament and indirect inguinal ligament. Direct inguinal hernia and about indirect inguinal hernia. About direct inguinal hernia, content of abdomen, enter the deep inguinal ring, enter the deep inguinal ring, enter the deep inguinal ring and transverse the whole length of the inguinal canal, transverse the whole length of the inguinal canal. Whole length of inguinal canal to come out through the superficial inguinal ring. Indirect inguinal hernia, content of the abdomen, enter the deep inguinal ring and the transverse whole length of the inguinal canal to come out through the superficial inguinal ring. Next about indirect This is about indirect inguinal hernia. Then about direct inguinal hernia. Indirect inguinal hernia contains directly enter into the Hasselbeck's triangle. Hasselbeck's triangle. Contents protrude through the posterior wall. Contents protrude through the posterior wall. Posterior wall of inguinal canal. Medial to the inferior epigastric vessel. Medial to inferior epigastric vessel. Here about indirect inguinal hernia. Next, direct inguinal hernia. Content directly entered by Hasselbeck triangle. Hasselbeck triangle. Contents protrude through the posterior wall of inguinal canal, medial to the inferior epigastric vessel. The main clinical features. Swelling in inguinoscrotal region. Swelling in inguinoscrotal region. Second one is more prominent in standing and while cuffing. More prominent in standing and while cuffing. Cuffing or straining. Third one is progressive increase in size of swelling. Progressive increase in size of swelling. Relation of inguinal hernia and the cord. Relation of inguinal hernia and the cord. Direct inguinal hernia. Next, indirect inguinal hernia. Indirect inguinal hernia. In direct inguinal hernia, sac is posterior to the cord. Sac is posterior to cord. Indirect inguinal hernia, sac is anterolateral to the cord. Anterolateral to the cord. Next, types of inguinal hernia. Types of inguinal hernia. First one is bubonocele. Content is limited to inguinal canal. Content is limited to inguinal canal. Content is limited to here diagrammatic representation. Bubonoceal content is limited to the inguinal canal. This is the diagram of bubonoceal. Then second one is funicular. Processus vaginalis is closed just above the epididymis, just above the epididymis, just above the epididymis, and content can be felt separately from testis, felt separately from testis. Content can be felt separately from testis. In funicular, processus vaginalis is closed. Processus vaginalis is closed just above the epidermis, and content can be felt separately. And content can be felt separately from testis. Next, third one, complete. Processus vaginalis is patent throat. Hernial sac is continuous with the tunica vaginalis. Tunica vaginalis of the testis. Testis appear to lie in lower part of the hernia. Lower part of hernia. Complete. This is a complete incomplete processus vaginalis is patterned throughout. Hernial sac is continuous with the tunica vaginalis of the testis. Testis appear to lie in lower part of the hernia. Then there are some differences about direct hernia and indirect hernia. Differentiating features. Differentiating features. Direct inguinal hernia and indirect inguinal hernia. Indirect inguinal hernia mostly elderly. In indirect inguinal hernia, more common in young adults and children. Then about direct inguinal hernia, more than 50% are bilateral. In indirect inguinal hernia, in 2/3 cases, it is unilateral. And in 1/3 cases, it is bilateral. Then in direct inguinal hernia, the shape is spherical, and in indirect, the shape is piriform or oval. Piriform or oval. And then next, in direct hernia, does not descend to bottom of scrotum, but in indirect may descend in scrotum. May descend into scrotum. Next, about these are the main differentiating features. These are the main differentiating features of direct inguinal hernia and indirect inguinal hernia. Then special types of inguinal hernia. First one, Gibbon hernia. Second one, pantaloon hernia. Third one, sliding hernia. Fourth one, sportsman hernia. Sportsman hernia. Diagnosis, clinical diagnosis. Except internal and spigelian hernia. By CT scan. By CT scan. These are clinical diagnosis. Clinical diagnosis. Except internal and spigelian hernia by CT scan. And can be done by ultrasonography. Thank you.